More people are gaining weight because of the pandemic. It's a fact, right? And it's not just because they're eating more. New data released today shows roughly 6 out of 10 adults have packed on pounds since last March. It's gotten so bad that more than half of adults in every state in the country were considered either overweight or obese last year. Joining us via Zoom this morning is Rhea Farberman with Trust for America's Health. It's a group that compiled this data. Good morning. Thanks for being with us.
Morning. Thank you for having me.
So the report found that there are several factors that go into this, as we typically see. It's not just that people are eating more. Would you explain how this has really become a domino effect?
Right. It is more than what you eat. Certainly making good choices about what you eat and the amount of physical exercise you get is important, but it's really all the conditions in a person's life, the conditions in the community in which they live that are going to impact everyone's ability to make those healthy choices. And the pandemic very much had an impact on our ability to make those types of choices. For instance, when we had to shut parks and schools went to remote learning, rec centers were closed. So people had more trouble getting out and being physically active. And the pandemic also led to an increase in food insecurity for many families. And if you are food insecure, you have to stretch that monthly food budget. You're more likely to make choices that are less expensive, but also less nutritious and higher in calories. So the pandemic definitely added to what is now a 2-decade pattern of increase in overweight and obesity among Americans.
Yeah, and then of course, there are people who tend to, when they're stressed out, and certainly the pandemic has made all of us stressed, they turn to food to help try to calm them down. Let's take a look at the numbers for a minute, if we could, Rhea. So Florida ranked among the states when it comes to the number of people. It ranked at 42nd on the list. Not bad, but Georgia's numbers were actually much worse. It ranked at 17th. Why do you think that is?
Well, and again, it is very much impacted by things like poverty rates within a state, the availability of full-service grocery stores in communities within a state. So there's a number of factors. Many are linked to what are the conditions in the community? Can people make the healthy choice? Do they have access to a farmer's market or a full service grocery store? In so many communities across the country, lower income communities particularly, there are many more fast food options than there are healthy food options. Fast food options are often less expensive. So if a family has to stretch their budget, that might be where they go. But fast food options are less nutritious, they're higher in calories. We also want to make sure that the built environment in a community lends itself to getting out and being physically active. Are there parks? Are there walking paths? Are there routes that kids can take to school so they can walk or bike to school every day and get some exercise that way? So we have to think about the physical environment, we have to think about access to healthy food, and we have to think about lifting people out of poverty, because poverty is very much associated with obesity.
Rhea Farberman, this is the reality that we all need to be considering as we raise our own children, because they're models, right, in terms of healthy eating and exercise. Thank you for your time this morning. We appreciate it.
Thank you.